What does it mean for your practice, first part? And secondly, what does it look like? What does it feel like in the practice day to day?
So I think for our practice, what it means is that we can really comprehensively address patient need on a much larger scale, which we possibly wouldn't be able to do if we were just working alone. I think that's probably the core of it, because our patient population is largely underprivileged, Aboriginal health, homeless health, cultural and linguistically diverse. A lot of these people aren't able to access care quite regularly and also have very complex needs. So working as a sole GP with that cohort is really challenging, because it's not just about the medical care, it's about psychosocial, societal, home, housing, familial issues.
For us, it means collaboration and coming together as a team to be all contributing towards one goal and working together. And I think that's the key, is that we're working as a team to improve the outcome for the patient, and having everybody work at their top of scope so that we have the right person at the right time involved in the patient's care. And it kind of was born for us out of survival mode. We don't have enough GPs to see the volume of patients that we have in the practice. And unless we were willing to work in a different way and bring different health professionals into the patient's journey and all working together, we just didn't have the capacity to meet the needs of the patient.
For people in marginalised communities, health literacy and navigation is complex. So doing multidisciplinary care within the practice enables people to access allied health professionals that they may not have otherwise. And so that's one thing. But the other thing is it gives you this diversity of clinical and allied health views around patient care, and there's multiple benefits.
Yeah, it's all under one roof, so it's that accessibility. But it also means that we're not duplicating care, and we've got one person doing, for example, observations that's then shared between the whole team. So you don't have each health professional doing their own blood pressure multiple times, or the patient having to tell their story multiple times.
Very poorly controlled diabetic patient of ours. She's in her mid-50s, and she was coming to see me for her sugar control, and she's a very busy person. She's working FIFO type work, so she doesn't get time to actually come and address her issues. But we never actually got much detail apart from coming in, get your sugars checked, get your blood checked, let's talk about your weight, let's talk about how you're going, how's your mental health, quick chat, and leave. She finally actually did engage with our multidisciplinary team. So on one day she saw the podiatrist, the pharmacist, the exercise physiologist, and the chiropractor was also involved in our practice. It happened to be a day when we had our case conferences, which happens on a Wednesday. In the discussion in the case conferences regarding the patient, I learnt so much. I didn't know that the patient actually was having bilateral peripheral neuropathy, which is when she can't feel the bottom of her feet. She wasn't telling me that, and I hadn't thought to ask her about it. So she was actually at a high risk for heat injuries if she was exposed to heat. She was wearing steel cap boots, her foot health wasn't good. That then led on to the podiatrist explaining that she was actually experiencing pain up this part of her leg, which then led to the exercise physiologist saying, oh yeah, actually she did mention that to me. We actually think it's from the sciatic region. The chiropractor then put in her 2 cents worth. With that as a background, the pharmacist then had a look at her medications and said, well, look, her blood sugar control is not well managed on the insulin that she's on. Shall we just change it to this one instead? And then we put in a plan for follow-up. So that all took place in a 15-minute case conference.
So thinking about those practices that are about to embark on a journey of multidisciplinary care inside their practice, what are some of the tips or clues you would say they need to start to think about to prepare the ground for that transition to that model?
I think patience is a huge issue. So you need to be a little bit open-minded and be ready to accept that perhaps it won't function as per a normal GP practice. So you may not have your set bookings that will run to time.
Yes.
Of course, it depends on the patient cohort, whether they do come on time. A lot of ours don't. But just being aware that you're going to educate the patients that each consultation will take longer, that you will be seeing multiple people, and that you might need to invest that time into your consultation.
You don't have to be the expert in every single area. You have always referred to other specialists, and now you're bringing specialists in different ways into your own practice, and that makes your job easier It means the patient outcomes are better, they're faster, and you don't have the sole responsibility of having to pick up absolutely everything.
So, multidisciplinary team care, WAFA is committed to enabling this where we can, and we'll be working hard with other practices, but you are a model practice in this regard and, really at the forefront. So thank you both very much, and stay tuned.